Hi, in this video, we're going to be talking about the issues that you need to know when you are pregnant and you plan to do fasting. So, what is the impact on the mother? What is the impact on the baby that you need to really know? And last but not the least, if you plan to do fasting, what are those small things that you need to care about before you embark on this religious belief of yours? Hi, I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lenest, Malad, Mumbai. Fasting in pregnancy, staying hungry for religious reasons. This is one of the commonest things that you'll come across when you talk about religious practices and pregnancy. So let me just quickly discuss about this today. We're going to talk about three important aspects of fasting. One, the impact of fasting on the mother. Two, its effect on the baby and the baby's health. Three, if at all, in spite of everything, you plan to do fasting, then what are the factors that you need to be careful about and plan so that you don't have problem. So these are the three things we're going to discuss in this video today. So let's start off first understanding the fasting. Whether you are a Hindu, whether you are following Islamic religion, or whether you are a Jain, or whether you are Buddhist, the fasting is one of the practices which is part of our religious culture or practice for a very long time. And to say that this is wrong or right will be extremely shallow on my part to comment, because it's a religion and a custom which is to be debated with a scientific approach. So let us try to understand the impact, and then let us find a way out how we can not feel emotionally hurt and yet we can manage the things in an intellectual and a smart way. That's what we're going to discuss today. First thing is, the most important thing is, what is the impact on the mother? Okay, when you are fasting, actually first thing you need to remember is when you should not indulge in that. So if you are diabetic, or if you are anemic, if your general condition is not good, you're not supposed to indulge in fasting. The reason why this is very simple is that any religion, any culture, any religious scripture never ever insists on fasting for a pregnant woman. Whether it is Islamic literature, whether it is Hinduism, whether it is Jain, you look at anyone. So whether it is Ramadan, whether it is Chauth, whether it is Karwa Chauth, whether it is Paryushan, you are exempted from it. Ask your religious leaders, ask your, the people whom you strongly believe, who are educated in the religion per se, and you understand what I'm saying. But what are the effects on the mother? So first thing is that because of fasting, the symptoms of pregnancy which are already in existence may exaggerate. So what are those? Nausea, vomiting, constipation. This is known to exaggerate. Sometimes the headache is also increased. Some women may feel fever because of dehydration happening. Increased time limit of fasting for a larger number of hours or larger number of days can lead to reduced urinary output, dehydration, and also bad urinary tract infections, and that may be a little tricky to manage. Sometimes the patient also have issues like because of the fasting, the nutrition level goes down, and sudden spell of dizziness, weakness, and falling down, or syncopal attack. So these are the things that we are worried about as a doctor when a woman is insisting on going for fasting. Second issue is effect on the baby. Now, the primary effect on the baby during fasting is going to be extremely minimal if the woman is very healthy. But if there is an issue like, for example, woman is anemic or gestational diabetes or diabetic, then it is really dangerous for the baby. Now, there have been studies done at different times of pregnancy, whether it is the first trimester, whether it is the second trimester, whether it is the third trimester, and they have found different findings. One of the key findings was that if you are not eating well, especially in the first trimester, it may impact the baby's growth. There have been reports that the women who have done fasting for prolonged period during the course of pregnancy have landed up with babies with lesser birth weight. Although some studies say that the APGAR score may not differ a lot, but again, these are short-term studies with small amount of numbers of people indulging in participating in the studies. But the biggest thing that we need to know is that A, there is a risk of preterm delivery when you do fasting. B, the baby is not getting nutrition, so baby may have an impact on the development, and that may lead to growth restriction. And C, that it is not just right now during the fasting that we are worried about, but a baby's weight, if it is less, all the life in future, because of low birth weight babies having higher risk of adult onset diseases like ischemic heart disease, diabetes, etc., it may have a role to play. So if you are having prolonged period of fasting and very strict fasting, it may not be a great idea for your baby. But now, having said that, we are extremely emotional people and we are extremely, God-fearing people. So we may still want to do something, so that we've been, like, I get patients who say, all my life I've been doing this fasting. Doctor, let me do it. I'm very healthy, I'm very fine otherwise. Well, if you're planning to do fasting, remember to plan things out well in advance. So some of the golden tips that I can give you is, A, take a professional opinion, meet your doctor, look at your fitness levels. If you are fit to go ahead with that, then by all means. But if you're not, please listen to your doctor and don't do wrong things for your baby or yourself. Second, once you have planned it out, chalk out your time schedule. Chalk out your working time. If you're a professional lady, you need to see to it that you're not going to be affecting yourself physically, especially exerting yourself when you're fasting. C, make a diet diary. Make a list of things that you're eating in the whole day. Be systematic, be organized, meet a nutritionist, see the calories that you're taking in, see the type of food you're taking in. For example, extremely high level of sugar in one shot when you're having it, say for example at the time of early morning, when you're having your early morning meals before you start off the Ramadan fast, or at the end of the day iftar time, or when you are having a karwa chauth and at the end of the whole day you're eating at the end of the whole day's fasting. All these times, don't immediately have high sugar intake drinks, because that can shoot up your sugar levels and also your high insulin levels, and also it can lead to different type of metabolism. Go slow on your body. Staying fasting for a long number of days can lead to some of the complications. So if you are even doing fasting, ask your religious elders, ask your family elders, and see if you can have a modified fast. For example, liquid only fast, or you can have fruits instead of having a whole meal, or some people say, okay, I'm going to only have vegetarian diet, or I'm going to have a salt restricted diet, namak nahi lenge, and we are not going to have that, and all that kind of things can be acceptable in your community or family, or in your mindset, so that you feel that you're doing something which you wanted to do, and that will make you happy. I do understand that. Although if you ask your husband, he'll be more happy if you do just a simple Maun Vrat instead of staying hungry for the whole day. It's a common joke that most of these husbands tell me. But remember one thing, that healthy women doing a fasting for a few hours is definitely not a problem. But a woman who is sick, and if she stays hungry, and if she's affecting her health, then I think it is not a good idea to harm yourself and your baby because of your belief, which is not even recommended by your religious scriptures. Think about it. Thank you very much.